Hi, my name is Kimberly Hyde, and this video presentation is for William Carey University, Nursing 666, Instructional Strategies with Dr. Marilyn Cooksey. The assignment was to pick a topic that pre-licensure students needed to have. So I chose infection control and isolation precautions. I have two goals of the presentation. Goal number one, prevent the spread of infection for all patients, especially those that are critical and or immunocompromised. Goal number two, reduce the spread of infectious disease among patients and healthcare personnel. Objectives is as follows. Students will have gained the knowledge and purpose of standard precautions as well as isolation precautions. Students will be able to identify personal protective equipment, PPE, required for each type of isolation. And students will be able to state the type of isolation and discuss the implications for each. Before we go into talking about isolation precautions, we must talk about standard precautions. Standard precautions are the minimum level of precautions used when providing care for all patients. This includes hand hygiene as well as the use of PPE equipment to avoid direct contact with the patient's blood, bodily fluids, respiratory secretions, and non-intact skin. This also includes the prevention of needle sticks or sharps injury and the use of safe waste management practices. Remember, the first line of defense against the spread of infection is going to be hand washing. Standard precautions are mandated by Occupational Safety and Health Administration, OSHA, and the Center for Disease Control, CDC. It's to be used for all patients by all healthcare workers. If we all follow standard precautions, it's going to reduce the risk of bloodborne and other pathogens. Studies have shown that it's rarely the patient who has a known communicable disease that infects other patients and or healthcare workers. It's when the patient is not known to have a communicable disease that we put ourselves at risk. In other words, if I know that the patient in room 20 has a disease that I can catch, I'm going to take the necessary precautions. But if I'm not aware of it, if he hasn't tested positive or it hasn't been documented yet, it's been shown that we don't take the proper precautions and therefore we expose ourselves to perhaps getting what he has. So with the use of electronic health records, that has been something that's been decreased. Patients are being identified sooner that have a communicable disease, or perhaps they've been colonized for an organism, or perhaps they have a multi-drug resistant organism that they've tested positive for in the past. All of these are reasons that a patient should be placed in isolation. So the electronic health record helps healthcare personnel to identify these patients. Now, as a healthcare personnel, we're all at risk for diseases transmitted by infected patients and therefore must use standard precautions appropriately as well as implement isolation precautions as needed. So as we begin to talk about isolation, I'm going to show you some of the PPE equipment that we use to protect both ourselves and the patient. But first I want to talk about hand washing. Hand washing is a major component of standard precautions, and it's one of the most effective ways to prevent the transmission of pathogens within healthcare. There are 5 key moments for hand hygiene. Hand hygiene includes washing your hands as well as using an alcohol-based solution to clean your hands. However, if your hands are visibly soiled, then you must use soap and water. That's not an option. That's something that's mandatory. If you touch something in the patient's environment and your hands are not visibly soiled, then it's okay to use the hand-based sanitizers and or gels. Okay, so the 5 key moments for hand hygiene. The first one is going to be immediately before touching a patient. You come into the patient's room, before you approach and touch the patient, you want to make sure your hands are clean. This is going to protect your patient against harmful germs that's carried on your hands. The second moment for hand hygiene is before any his or her body. The third opportunity for hand hygiene is going to be immediately after blood fluid exposure risk, or glove removal. When you take those gloves off, the very next thing you should be doing is some type of hand hygiene. This is going to protect both the patient and ourselves from healthcare environmental hazards or harmful patient germs. The next opportunity is after touching a patient, you want to do hand hygiene. And the last time you want to do it is after touching anything in the patient's room and or environment. You come into the patient's room, you touch the over bed table. Before you leave out the room, you need to perform hand hygiene. Anything that the patient could have possibly touched and or contaminated in that room that you touch, you need to make sure you're performing hand hygiene when you're done. Okay, we're going to talk about isolation precautions and infection control strategies that's designed to prevent the spread of infectious agents. So we have Contact Plus, we have Droplet, we have Airborne, and we have Protective, that's also known as neutropenic and or reversal. Whenever you have a patient with a contagious disease, there are certain personal protective equipment that must be worn to prevent the spread of infection. The type of isolation is going to be determined by the causative agent and the route of transmission. And all family members, healthcare workers, yes, anybody entering that patient's room must observe the precautions as mandated. So the first thing we're going to talk about is contact. With contact isolation, you're going to wear a gown and gloves in addition to the standard precautions, which means that when you walk in, before you go and approach the patient, we're going to do hand washing. Hand washing is going to be the first thing we do and the last thing we do. But you're going to wear a gown and gloves to protect the patient as well. So here is an example of what the gown looks like. Typically they come individually wrapped. You want to open it up. You want to put the gown on. And you want to tie it coming to the front. This ensures that all of your clothing is protected. You also want to put on some gloves. So you have your gown on, you have your gloves on. This is what you should look like going into a patient's room that's on contact isolation or contact plus. Reasons why your patient may be on contact precautions: if they have scabies, if they have lice, if they have Ebola, if they have herpes simplex virus, diphtheria, if they have impetigo. All of these are transmitted by touching something on the patient through unbroken skin, things like this. So the way that we protect ourselves is that we wear a gown and gloves. Whenever you have a patient on any type of isolation, you always want to talk to the patient and their family and educate them, because you want them to be safe as well. You don't want them to contaminate each other as well. When you get ready to take this off, remember that your gloves are now dirty. The front of your gown is dirty. So you want to just like tear it off. Once you tear it off, you can just pull it down. And I usually just wrap it up as I'm going along. And I take it off. Everything is inside here. And I trash it. Once you trash that, you do hand hygiene. You're going to wash your hands or use an alcohol-based sanitizer. The exception is this: if your patient is on Contact Plus, you must use soap and water. Contact Plus have organisms that are not killed by the hand sanitizer. These include C. diff or norovirus. So if your patient is on Contact Plus, you must use soap and water. Hand sanitizer is not going to be an option for this type of isolation. But you're going to do the same thing we did before. You're going to do hand hygiene both before and after, gown, and gloves. The other thing is that whenever you have a patient on isolation, you always want to restrict their movement. In other words, if your doctor orders a chest x-ray, see if they can come up to the room and do the x-ray. risking exposing other people to their disease process. The other thing is that when you have a patient in isolation that requires isolation, they're going to be isolated to a single room, a private room. If there is not private rooms available, then you can do what we call a cohort of patients. That is, patients with the same disease or microorganism can be grouped together. Now, I will tell you this, in the hospital setting that I work in, we rarely do that. It's very seldom done. If there's not enough beds available, even on different units, then we may do that as a temporary measure. But most of the time, we're going to make a way to isolate that patient in the room alone. So you just want to remember key points: private room, wash hands before and after, wear gown and gloves. The other thing I didn't mention is that if you have a patient on contact or contact plus, you want to use disposable equipment. You don't want to go in with your personal stethoscope and listen to the heart and lung sounds. We have disposable stethoscopes that you can use so that when you're done, you either leave it at the bedside or you throw it away and bring a new one into the room. But you want to use disposable things. If you can't use a disposable item, like the computers on wheels, when you finish in that room and you exit, you want to wipe that down really well to make sure that nothing else gets contaminated. Okay, we're going to talk about airborne. Airborne precautions also include standard, washing your hands before and after entering the room. However, these are particles that are so small that they can be spread across the room. They can float in the air and travel long distances. So again, they need a private room, they need a negative pressure room, and we need an N95 mask. This is the N95 mask. There's a fit test that's to be done for all new hires to make sure that you have the appropriate mask. Once you are fit tested, then you qualify to take care of a patient that requires airborne isolation. If a patient is on airborne, it's usually because they either have tuberculosis, they're suspected of tuberculosis, they could have measles, they could have varicella, which is the chickenpox, they could have smallpox, they could have SARS. All of those would be reasons why we would put them on airborne precautions. If the doctor orders AFBs on the patient, they're thinking that they may have TB, generally we're going to put them on isolation because we want to be protected in the event that the test comes back positive. So even if the patient does not have something that they're looking for, if we think that they have it or the doctor wants to rule it out, we're going to protect the healthcare workers and we're going to wear these masks. So the way you want to put this mask on, I'm not going to be able to talk you through this, so you're just going to have to observe. We're going to put the top strap on first, then put the second strap on. I'm going to squeeze this metal cord to fit my nose. The thing to remember when you take it off is you don't want to touch the front of the mask because all the particles that's floating in the air, they're now to the front of this mask, and we don't want to get contaminated with that. And again, after we remove the mask, we want to do hand washing or hand hygiene. Okay, so this is what you will look like with the mask on. If your patient is on airborne precautions, you must wear the N95 mask when you go in and take care of them. When you're done, you want to keep the mask on until you exit the room. When you exit the room, then you can take the mask off. And again, we don't touch the front of the mask, and we would discard it. Now, some people have allergies to that, and there's a different kind of mask that's not as constricting, I guess. And this is the same kind of deal. You're going to put this on. So at this particular facility, we have both styles of masks. Some people have preferred one over the other. Some have allergies to the N95, and this is an approved substitute. The same thing, when you're discarding the mask, you do not want to touch the front of the mask. And you would take it off and discard it.